The 8-year-old civil war in Yemen intensified again this week as airstrikes by the Saudi-led military coalition killed at least 85 people. The conflict and COVID have devastated the country's health system, and it has also prevented a Canadian non-governmental organization from being able to provide much-needed training to medical staff in the country. But as Philip Lee Shannock reports, the group has found a way to use technology to its advantage.
5 trainees examine a child in the pediatric ward of a hospital in Al-Mukalla, a port city in southern Yemen. They use a small handheld ultrasound device to scan the child's chest, a pilot project by Toronto-based Bridge to Health. They're the first in Yemen to learn to use these small handheld scanners.
This patient is pretty tiny. These are the ribs.
Half a world away in his home office in a downtown Toronto condo, Dr. William Cherniak can review the scans done by trainees in Yemen and give them feedback on how to improve their techniques, as well as guidance on making a diagnosis.
We were supposed to actually fly in and bring the devices with us for an initial 1-week training period. But because the pandemic kicked in just as we got approval for the grant, we actually had to figure out, how do we get these things in a country without us going?
With money from Canada Grant Challenge, which is supported by the federal government, nonprofit Bridge to Health sent 10 scanners to Yemen and pivoted to online training. It also meant getting the hospital access to satellite internet, which is more reliable than what they have.
And so this is, to my knowledge, the first time ever where we're trying to do 100% of the training 100% remotely.
Dr. Nareen Ahmed is an assistant professor of clinical medicine at the University of Pennsylvania. She's the head of ultrasound training for Bridge to Health. Along with instructing the trainees by video link, she reviews the scans they upload to the cloud.
If I place a comment on an image, they can see it almost immediately in Yemen. And so that's pretty incredible to be able to give that kind of real-time feedback.
Ahmed says from detecting pediatric pneumonia to pregnancy complications and abdominal trauma, access to diagnostic medical imaging saves lives.
We can really improve these kind of healthcare outcomes across a country that has been absolutely debilitated by warfare and famine.
Dr. Abdullah Hamoud Baghaiza is with Med Global, a U.S. NGO that Bridge to Health works with on the ground in Yemen. He says the ratio of trainees is roughly 50-50 men to women, and all have medical backgrounds.
The issue is not on the devices only, but the main issue is how the trainees can be a trainer on the future.
And Bridge to Health says it's this model that will have a greater impact than a medical mission that parachutes in, delivers care for a short time, and then leaves. Philip Lee Shannock, CBC News, Toronto.